My name is Jim, and this is my lovely wife, Julie, here.
Lovely.
Been my caregiver for the last 6 months, along with a lot of other people who have helped as well.
Yeah, we're snowbirds, and we usually go home in May.
20 years of being a snowbird got interrupted. I've been in and out of the hospital, surgeries, etc., for the last 6 months. I'm pleased with Doctor's Choice, even right down to this interview, to tell you the truth, because it's caused me to reflect on the whole process.
It was a relief to them to come and show me how to do things to help him and then make him feel more comfortable. So that was a big relief, especially the nurses, because I had to do that hands-on stuff. Kind of grateful, very grateful they came, because they helped him so through healing him up, and then when he'd go back to the hospital and get down again, they'd come and get him better.
A lot of people would have one thing, the wound. I have the wound, I have the two colostomy and a urostomy, so I'm double trouble when they walk in, or triple trouble, because they may have to change any one of 3 dressings, you know. One of the spells where I went into the hospital, I had a blood infection, and so they had to give me antibiotics for that. 29 days of it, and 16 of those were in the home. I got to the point where I could hardly swallow. I couldn't take my pills, and I had just almost impossible to eat. So they sent a speech therapist. She helped me tremendously to get to the point where I had some exercises that she gave me, and I'd do those exercises, and then I'd progress with my swallowing to the point where one day I just went about my business, you know. And then I thought, boy, I haven't thought about swallowing today. She was wonderful, the speech therapist was, as they all are. You know, I wasn't familiar with what they would do exactly. It's totally different. They have their own approach, and they're all very good. Everyone in Doctor's Choice would be a doctor's choice if I were the, they're good people. They're concerned about the patient. They try and do their job to the best of their knowledge and ability, and that's high. So that's good.
Well, I think an important thing is that they're very patient.
Oh, yeah.
With
extremely
us,
patient.
You know, like some days they might come and I'd still be in my pajamas and robe, but they're very patient with answering questions and helping you. So I really like that right from the get-go.
When you're in my circumstance, you appreciate the fact that these people are taking time to spend with you. It's not something that, well, they love their work. You could tell that they love their work. And that's extremely important.
Like this last time, I feel they've done their job so well that we can fly home. Because for a while, it was like, we're just gonna stay down here.
You know, a thing that surprised me a little bit was how they all seemed so happy when I finally told them I was going home. They all know Michigan is my home, so they all know I'm going back up there. But by golly, I've sure been happy to have them down here. My wife couldn't have done it without me. I couldn't do it without her. And neither of us could have done it without the home health care. Doctor's Choice is right up there. I know I had 2 choices when I fell out of it. Both times I had a choice. Who do you want? I want Doctor's Choice.